for the past probably 6 to 8 weeks. You might ask, why did Lakeland's number, which is the orange line, decrease? I don't know for sure, but my guess that may be some data lag because of the holidays. So don't hang your hat that Lakeland is necessarily doing better. I am very much concerned. You'll see as a county that our numbers have been increasing and trending very significantly upward, and we're far higher than we were in July when we had our first peak. Other indicators, if you go to the next slide, Kevin. This graph reflects our positivity rate for testing, and you will likewise see that our positivity has been exceeding 10% since the beginning of December. Again, the slight decrease, I would not call that a trend yet, because again, I think it may reflect some data lag, but I am quite concerned that 2 of our key community indicators are worsening. The positivity rate, I am not able to run it just for Lakeland residents, so this is countywide. Additionally,
Dr. Jackson, could I interrupt with a quick question? Because we hear the question asked a lot. If I get 2 tests, is my second test part of this positivity, or is only the first test part of that?
This reflects, it excludes those who have tested positive before. So this reflects positive for people who have tested positive for the first time. So as you know, in the past, some people would get multiple tests and they were always positive, or they may be positive 2, 3, or 4 or 5 times. This graph reflects positivity for the first time, not repeated positives.
Thank you very much.
Yes, sir. All right. Additionally, syndromic surveillance, which again, I call it the ticker tape of what's going on in our emergency rooms and urgent cares, does show a significant increase in the number of people coming to ERs and urgent cares, either with the diagnosis of COVID or with signs and symptoms that could be COVID. So that's sort of an early warning system. Additionally, Polk is now over 800 deaths. I do not have the breakdown or trend for that right now, but our death numbers are increasing. And I'm sure that Danielle will be speaking about hospitalizations. I can tell you on any given day now, across all of our 5 hospitals in Polk, we're exceeding 300 cases. When about 6 weeks ago, we were running about 98 cases. So we're about 3 times more people in the hospital now with COVID-19 in ICUs and on ventilators than we were 4 to 6 weeks ago. I appreciate Dr. Ockinger's comments that this disease is now putting a strain on both inpatient and outpatient healthcare providers. He very eloquently talked about the mitigation strategy, and this, again, avoiding crowds. Congregate only with those you live with. Large mass gatherings are the highest risk per CDC, but additionally, we're seeing a lot of individual cases in smaller family gatherings. The CDC recently updated statistics. Before, we anticipated that 40% of people with COVID were asymptomatic. That has been up to 60% of individuals with COVID are likely asymptomatic. So this obviously is a perfect storm for disease spread. So please continue the mitigation steps. Are there any questions about the numbers or what we should be doing as individual members of the community? Or I can proceed to an update on COVID vaccine in Polk.
Commissioner Selvage.
Yes, thank you, Mayor and Dr. Jackson. Dr. Jackson, have you recommended to the county commission that they implement a countywide mask mandate?
Commissioner Selvage, I speak with the commissioners on a regular basis. They know what my thoughts are, but just like your decision regarding policy to affect the city of Lakeland, it's their decision to reflect policy for the county. And obviously, we do not have a statewide mandate for masks.
Okay.
And I fully understand that our elected officials are being pushed and pulled by different sides of this argument. I go back as a scientist to what will stop eventually this outbreak, and the science for not only COVID, but any other infectious disease, from measles to anything else that's transmitted aerosol, is you've got to separate people, i.e., physical distancing, avoiding crowds, wearing masks when we have to be around one another, and we have to rely upon vaccination, which is not going to be an immediate silver bullet because of access and because of the time it takes to develop immunity. We need to have enough people in the community who are immune, and that will only come through disease or through vaccination.
Thank you, Dr. Jackson. And I do not want to ask you to step into the policy realm. I ask this question from a medical perspective. Do you think that a mask mandate at this point in time will help mitigate this crisis? Just from a purely medical standpoint, is the horse out of the barn? Is it too late? But if we implemented a mandate, will it help slow the spread of COVID?
I believe that masks are a part of the solution. Yes. So my direct answer is yes. But it by itself is not the ultimate solution. We have to use all of the efforts of masking, avoiding crowds, hand washing, social distancing, and getting the vaccine when it's your turn. All of these things need to be done. Yes, sir.
All right. Thank you, Dr. Jackson. Mayor, that's all I have.
Thank you very much, Commissioner Walker.
Good morning, and thank you, Mr. Mayor. Dr. Jackson, a couple of things I'd like to ask. And thank you for the comment about the mask wearing is only part of the solution, because there's other things that need to be done as well. And you mentioned them, and I appreciate you mentioning what you did in reference to what can be done, because mask wearing is only a part. We still have to avoid crowds. We still have to keep social distance. Those kind of things still I think is important that we need to stress as well. My question to you is about vaccines, because I got numerous phone calls latter part of the week, this past week, about registration and appointments. How is that going now? Because, I know we had probably, exorbitant number of people trying to get online, trying to get on the phone line to make to register and to have the appointment generated. How are we doing with that now? Is that progressing even better than what we noticed the latter part of our week, this past week? Or are we still at that junction, where things are still combobulated? I think it's some more less word to use at this point.
Yes, sir. So yes, I'm very happy to let you know about what's going on with COVID vaccine in our community and access to getting appointments. To let you know, to date, 17,000 vaccines have arrived in bulk to vaccinate priority groups as outlined in the governor's executive order. These first priority groups are healthcare workers who have direct patient care duties and are residents 65 and older. I'm not going to speak about the vaccination of long-term care facilities, which includes nursing homes and ALF, because that is being conducted through a federal program utilizing Walgreens and CVS. I do not have an update on how many of our facilities have been vaccinated. So the numbers I'm going to give you really is in reference to vaccinating our direct line healthcare workers and our 65 plus. The 17,000 vaccines have arrived in bulk. These have gone to three types of entities. One is our hospitals. All 5 hospitals received allocation to vaccinate their frontline staff. And each hospital is graciously now helping to vaccinate other healthcare workers in the community. I'm sure that Danielle will be speaking of that. Additionally, our FQHCs have very recently received an allocation of vaccine to again vaccinate their staff and to then transition to helping to vaccinate the 65 plus. The county health department has received allocations of vaccine, with our priority groups being 65 plus, to assist with vaccinating healthcare workers. And we have received so far 5,400 doses over the past 2 weeks. By the end of this week, because we have 3 vaccine events planned this week, all of those 5,400 doses will be in arms. So people have, as you can imagine, you have seen in the newspaper, you've had complaints. People are clamoring because they can't get hold of us. The phone system, we have at the health department locally a COVID information line, which we have a dozen staff members who answer that call and have been since April. When this vaccine issue came up, we tried to handle these vaccine-related calls through that call center, and it was an abject failure. Our phone system was not able to handle the volume of calls. The county stepped up to the plate very quickly. That call center has now been transitioned to being at the Emergency Operations Center with a new phone number, and we're manning it with at least 20 people, and it's a combination of health department and county staff. That went live on Friday. Within minutes, that system was inundated. Fixes were done, and I'm happy to say, and this seems like a small pittance, but right now we've got over 2,000 individuals that have either been scheduled or they're on a waiting list. So my plea to the public is if you are 65 and older, wish to be put on the waiting list for a vaccine, please call the number, and I'm going to have to look it up because you're going to say, what is that phone number? Give me a minute and I'll find that. And someone will speak with you and will collect your information. And as we have vaccine come available, we will contact you and tell you where you can go. There are 150,000 individuals in this county that are over 65. Like I said, the health department has received 5,400 doses. This is going to be a month-long process. The way we're slicing and dicing this to try to get to people is a combination of large mass vac sites, which we are trying to stand up on a weekly basis. Our community partners have stepped up to the plate. We have assistance from Polk County Fire Rescue to help us monitor. We have assistance of the Sheriff's Office and Lakeland Police Department when we're doing mass vax to provide support. I will tell you, last Wednesday, we did a mass vax event at the Lakeland Health Department. We were anticipating doing 300, and we did over 500, and it went off without a hitch because we had support. So this is our high-level plan, but the plan can only go forward as we receive more vaccine. We are not getting additional vaccine this week because we have not expended everything we've gotten. We've got our name on the list for how many we think we can deliver next week, and we will see what becomes allocated. The state is receiving a very limited amount of vaccine from the federal route, and everybody wants vaccine right now. But I feel extremely comfortable that we have a coordinated infrastructure that involves our hospitals, our county support, the health department, and local healthcare provider offices to get us through this very much shortage time. What will happen over time as vaccine becomes more plentiful is that residents will be able to see that there will eventually be vaccine available in pharmacies and through their private healthcare provider. But I do not know how long that is going to take. So please, we all need to continue following the mitigation steps, particularly if you're over 65. Continue to very strongly follow mitigation steps. Keep your eyes open. We're posting updates to the health department and the county website for people that can see that, and the call center is open 6 days a week to receive your call. Additionally, the information center is still open for general questions and for test results for those that we've tested. So I will stand for any questions.
I have one last question, Mr. Mayor, before you let me go and go on to the next person. And that is, Dr. Jackson, do you feel comfortable? I guess maybe I may not be asking this in a correct kind of a way, but the way I can only say is what comes out my mouth. And that is, do you feel Polk County have received the number of vaccines, I guess whatever our allocation has been, comparatively speaking, to our population of those who are 65 and over, as the number you just shared, you think we're getting that number that we should receive? And I guess comparatively speaking to maybe our neighbors, as far as the allocation is concerned. I hear some talk about, maybe we're not getting what was due to us or whatever. You hear these kind of things. But I want to hear from you as our professional and the director of our health department for our county. How do you feel about the allocation that we're getting and what's now coming down the tube for us?
Well, Commissioner, I hear your question, and are the allocations equitable? I'm not sure what the formula is for defining what goes to which county. I will tell you that some neighboring counties, which are larger than Polk, have additional infrastructure from the state to support. So there is a bit of a skewing of how many they get. There is also nothing that requires a resident to be vaccinated within their own county. So I encourage people to look to where you can get the vaccine first if you're eligible. Am I personally advocating for our county? Absolutely. I've been on calls each week with representatives, or twice a week, or 3 times a week with representatives of our hospitals and our larger health clinics. I'm in communication with Tallahassee to advocate. It shifted from pushing out what we think we can give to me presenting to my leadership what I know we can give next week, and hoping that this will drive our allocation, which comes week by week.
Thank you very much, Dr. Jackson.
Yes, sir.
Thank you. Can you hear me okay? Oh, good. I have a different mic. Thank you, Dr. Jackson. And I just want to, I was thinking this morning before this meeting with Dr. Echinger and Danielle Drummond and Dr. Jackson, you specifically, that you all have taken on a Herculean task that has not relented in the least since March. So we really appreciate your leadership, Dr. Jackson, specifically at Department of Health. I know this is not a thing that you ever signed up for. So thank you for continuing to work on behalf of all of our residents throughout Lakeland and Polk County. Just a couple comments really. As far as the health line, I know that the vaccine line, I called 200 times on Friday to try to get my mom in the queue, and to no avail, and started calling again this morning, and she's been on the phone for an hour this morning and still it's ringing busy. I know that's just probably the influx in the volume, but I'm excited to hear that you think that down the road that maybe primary care physicians can provide this. As our older population has played by the rules and worn masks and sheltered in place and done all the things they're supposed to do, I think that it's really on us to help you be as successful in distributing the vaccine as possible, just to give them a little bit of a reprieve, just like you all need some reprieve as well. So I was happy to hear you say that. Was my original question, was about primary care docs being able to distribute this later on as maybe more volume. Do you see in the next weeks or months, I don't know what the timeline looks like to you, because I'm sure you're drinking from a fire hose every day, but when do you think the state or the feds will release more vaccines? And I'm encouraged to hear you say that you're presenting to your leadership, what you think you can handle in distribution, the numbers, and maybe that will get us a few more vaccines. Like, do you have any recommendations? So I have 2 questions. A, do we have an anticipated timeline of when we see more vaccines released, which might be the, $1 million question? And 2, do we continue to call for our loved ones who are 65 and older to try to get them in the queue?
So the answer to the first question is I do not know when allocations will increase from the federal level. I think you said it. That's the $1 million question. Number 2, please continue calling. And I failed to mention that the county information technology group is working on an online portal to allow people to submit their interest in a vaccine online. That is in development. So I'm in hopes that will be available, and I can't put words in the county's mouth, but they've got a team that's working fast and furious, because there's really 2 issues right now. Number 1, people want to be heard. They want to have their name on the list because they want a vaccine. That is really issue number 1. And then issue number 2 is having enough vaccine to put in the arms. So we're really working upstream on both of those. But number 3, having vaccine partners, I feel very comfortable. We are spread across our 2,000 square miles to be able to accommodate folks once vaccine is available.
Commissioner Selvage.
Thank you. And this is addressed to Dr. Jackson and Dr. Ackinger, but I'm surprised by how many of my younger friends tend to think that this is no more than the flu, and if they're young and healthy, they can get through it. And so they're more likely to congregate in crowds and go to bars, etc. And I wanted to ask about this asymptomatic. Is this an accurate statement? If there were 100 people gathered in a crowd and we have a 15% positivity rate, is it probable that 15% of that 100 are asymptomatic and are transmitting the disease to somebody else unknown to them?
You know, by the numbers, in theory, that's possible. Now, there's a lot of caveats. What type of crowd is it? What age is it? The median age of people in Polk being diagnosed with COVID right now is 42. But again, a lot of younger folks are asymptomatic. So if we truly knew the disease burden, my guess is it would be even younger than that. So my plea to those who are not concerned about their personal health is to say it's a civic responsibility for all of us to act responsibility for our immediate group of family and friends, but to also act responsibility for the community, particularly during these extremely troubling times.
Dr. Jackson, I had asked you earlier about the number of times we count positive tests. Someone raised the question, how many times do we count negative tests? Do we count the first time only on a negative test? And is that correlation the same?
No, sir. Negative tests are counted each time.
Okay, then I saw Commissioner Madden. And then Dr. Ackinger has a comment. Dr. Ackinger, make your comment because I think it related to what I just asked.
Okay, I'm sorry. I just wanted to just respond to what Commissioner Selvage had said. Number one, I think that, you're right. Messaging has been very difficult with COVID-19 because it gets tangled up with political views. I just would want to put to rest anybody, any thought that this is the flu. This is a completely different illness. It's not related to the influenza virus. It is a respiratory illness that is a multi-systemic disease that infects it infects the lungs. It can cause blood clots. It can cause strokes. It can cause heart problems. It can cause neurological disease. It is a completely different illness. So we just have to continue to tell the truth and tell the information out there. So anytime you encounter someone who makes a suggestion that this is the flu, that this is simply not correct. I don't know how to respond to that other than just to try to correct the facts. And I would just echo what Dr. Jackson had mentioned. How do we get people, the message can be contradictory to folks. How do we get people, when they know that there's a substantial chance that they will be asymptomatic and not have any significant problems from the illness, how do we get them to cooperate in the mitigation strategies? And I think you just have to appeal to their civic duty, their sense of morality, and the sense of patriotism, I suppose. We're all in this together. It's the other argument you could possibly make is now that we are seeing the strain on our healthcare systems. I just pulled our numbers from our urgent care while the rest of the group was speaking. We have 80% more arrivals and visits in our urgent cares than we did December of the year previously. So we're not designed to be working at 80% higher capacity for a long period of time. We can do it. Our doctors work hard, our nurses work hard, our staff work hard, but they can only be pushed so far and so hard. So right now we are in that strain. I want to make sure that we understand, because I'm glad we're talking about the vaccine and the hope for the future. But right now, I think the emphasis needs to be put on that we're at a severe inflection point right here where we could be seeing overwhelming of our healthcare system locally. And that's going to put people in peril who have no COVID-19 whatsoever, people with heart disease, people with cancer, people with other treatable illnesses that we just simply won't be able to treat effectively. So that's where really the emergency is. And I think that mandating masks, really giving people to take seriously these social distancing is the only way the only tools that we have right now until we can get to that vaccination stage.
Commissioner Madden. Thank you, Dr. Atkinson.
Thank you, Mayor. Can you hear me okay? Okay, great. I had a couple of things that I just wanted to mention before we go on to hear from Lakeland Regional and their capacity. I really appreciated that last comment from Dr. Ockinger about the 80% more arrivals in urgent care this December year over year. So I really feel like one of the goals of this commission has been to not be the boy who cries wolf, to not be panicking when a hurricane is coming and it's hitting Pensacola and we live in Lakeland, but to really be focused on what's happening here locally. We have a large, vast country, and certainly it's scary when we watch the news and see things are happening in other places. But if we overreact when it's happening in New York and California, then we already have fatigue before it hits our area. And so I feel like that's been one of the things that we've been very conscientious about, is to make sure that we are not putting undue regulations or strains on our populace when it's not necessary, but really looking to our local healthcare professionals to say, is it here now? Is the cone of the hurricane, on Lakeland? And if it is, that's when we all need to go the extra mile. That's when we have to do things that we don't typically have to do because it's more prevalent. I do want to say that to Commissioner Selvage's point, I think the percent positive is certainly not representative of the entire public. Am I right? The percent positive is of those tested. And I would imagine that as people are being quarantined and around loved ones over the holidays who are positive, a lot of people going back to where they came from over the holidays are testing because they've either been near someone who they know has COVID or have symptoms. So certainly that wouldn't be that 15 or 20% of the population or of every 100 people have COVID asymptomatically or symptomatically, but just of those tested. So that's one question to clarify the percent positive. The second thing is, certainly it sounds like from Dr. Jackson that, we're waiting on allocation of vaccine. And I know the whole country and the world, frankly, is working on and waiting, kind of like we were all in the same boat waiting on PPE. I would like to just say that if, as soon as the health department knows or our county is aware of dates and times that we'll be receiving an influx of vaccine, if the logistical acumen gets you a higher ranking or your capacity for distribution gets you more ability to get more vaccines, I would suggest, like we did with Lakeland Regional Health and opening the RP Funding Center, to have great capacity for widespread mass vaccination events where we can social distance, that we want to make sure that as a city, we are offering every city facility to have those mass vaccination events in a socially distanced way. I certainly know that to have capacity, you need the healthcare providers to distribute the vaccines, but I would imagine that the facility would measure how quickly you could do a mass vaccination event. I also I've had several residents say they really feel their church, churches have either been closed down or only open once a week. There are large facilities here in Lakeland that could facilitate a mass vaccination event. And I know I've spoken to some pastors and to some congregants who wanted to volunteer that today when I came to this meeting, that they would love, to offer their facilities if there was any type of need for that, for a mass vaccination event. So certainly those are just, my second points are suggestions as we're looking forward and hopeful to getting more vaccination, that please remember the city and also our local churches for these, potential mass vaccination events. I think you addressed the holiday gatherings. I think we all anticipated, that we just would not be able to follow all the CDC guidelines. People have been, away from their loved ones and just craving to have those gatherings, and certainly, are seeing a spike as a result of that. But I'm hopeful that, as we, as a commission, hear the information today, know that we have not had a meeting in months like this. So we've given everyone a little bit of a break and did not give onerous, regulations, on the Christmas and holiday season, that we could now say, we are your cheerleaders. We're at the last leg of the race. We can't quit now. We have to get back to what we were doing before, because I do think even if we do a mandate, I don't maybe get out enough, but most of the places I go are still requiring masks. But I think it is imperative that whatever we do, we become those cheerleaders on the sideline saying, the vaccine's in sight, but we can't give up now. We can't get off course. We have to continue to do all the things that the CDC requires. So those are just kind of my initial feedbacks on all the things that have been spoken. But I would like to just have either Dr. Ockinger or Dr. Jackson just clarify, the percent positive as to how many people within 100 people, in a gathering would have COVID.
You're correct on that. The percent positivity is a percent being tested, Commissioner Madden. So you'd have to look at the case rate overall to sort of get a sense of how many asymptomatic people would be in a crowd of 100. When we are having about 600 people who are currently infected on a daily basis, those people, if half of them are asymptomatic, they may be expected. So that would give us about 300 roughly countywide every day. And those folks are infectious so it's a kind of a bit of a complicated question, but those folks are infectious for approximately an 8 to 10 day period. Dr. Jackson could please correct me if I get any of these incorrect. So you're looking at really, maybe a couple thousand people who would be asymptomatic at any given time out of a county of 600,000. So obviously it's not I don't want people to think that 15% of the county is walking around with asymptomatic disease. That would be way of an overstatement of the true risk. But I do think that we just sometimes underestimate the number of people that we do come into contact with on a daily basis if we aren't socially distancing. So no, you're right. The 15% is just the folks who are being tested.
And the whole point of that is that it's because we don't know that our protocols have to be pretty consistent across the board in order to make sure that we have defended ourselves and others against what we could be spreading and or receiving. Commissioner Reed.
Thank you, Mayor. Can everyone hear me? I presume you can. Okay, great. As we know, our northern friends are here now for the most part. So we have a big influx of senior citizens, and I know they have major concerns. One of my questions is, maybe I answer it first. Are we seeing more older people getting tested, coming out tested positive because of the amount of test giving, number one, and number two is because of the northern influx we have?
Mister, I don't have a breakdown on the age of people being tested. I can't give you that data. I can speak to the age range of those who are testing positive, but not those who have tested.
Okay, mainly I was just want to test it positive. I know we have an average of 42 years of age, but I didn't know if we're seeing it, if the ones that are testing positive, since we saw a spike over 4th of July, saw a spike over Thanksgiving, we saw a spike in Christmas, and now we're seeing a spike over the January 1st. but I didn't know because of the influx of people, are we having a lot bigger testing positive of our senior citizens right now?
No, sir. And I'm sitting here looking at the report that came out yesterday, or actually I'll give you a rundown. On January the 9th, we had 363 new cases. And those cases ranged mostly between 24 years of age and up to about 74 years of age. And it's almost a bell-shaped curve, with the greater percentage of 16% being in the 35 to 44 age range. We only had 10 people in the 85 plus age group that was a new case on the 9th.
Thank you. And I think that comes to the point where Commissioner Salvage mentioned, they're going, I'm out. And as I see most businesses, and where I go, I wear a mask and I wear a mask everywhere, by the way. And I think it's the quality of mask also has a lot to do with it. And I have one that has a high micron interchangeable system. I can change it out and wash it or purify it or what do you want to call it on a daily or weekly basis. You get inserts that are better quality ones. And I see my older citizens are wearing masks, and the younger people necessarily may not be. But the other question being is Tampa has a more restrictive component for mask wearing, and are their numbers continuing to go up as well?
I don't know off the top of my head. I can look it up for you, but I don't have it available at the moment.
I thought some stuff that Mayor Muntz sent us that shows Tampa is greatly increasing too, even though they have a much more restrictive area on mask wearing. Their
lines follow ours in terms of up, but their percentage is lower.
Okay. And there again, as far as the vaccine go, I think we've only got like 1.5 million in the state of Florida so far, and I think in New York they've got 5 or 6 million, and of course we have a higher population base than they do. And I didn't know if we in the two dose protocol within 28 days, are we going to be able to meet that threshold as well? And again, I would hope we could lobby to get more vaccines, because we're way deficient compared to population base from that standpoint.
Yes, sir. We very much advocate for the two doses. We have not started receiving second doses yet in Polk because our first vaccine was given just a couple of weeks ago. So we'll see how it goes. But we have not begun receiving second doses yet.
And I have two more questions. In our IC units, how many people in our IC unit are on ventilators?
Danielle will talk about that, I think, when she gets to her report. Yes. So let's just hold that for that. Okay.
Okay. Of course, we know that the COVID does not discriminate on who it does attack, but we know it discriminates on those that die. And so there, like I say, I do think we need to take care of the ones that have pre-existing conditions, our Black citizens as well as our older citizens as well. So there again, like I say, I wear a mask. I have the best quality mask I think I can get. It's unfortunate when I see people with, seems like no protection to me, but they're going to call it a mask anyway. But I think that's going to be a big factor in times to come. But thank you for all your answers. Have been most enlightening at this point.
Thank you, Commissioner Reed. Any other questions by commissioners before we do Danielle Drummond's report? All right, then if you could do that, Danielle, that would be great. Thank you.
Absolutely. Thank you. Can you all hear me okay? Great. Well, very appreciative, first of all, for everyone taking the time to talk through this very important topic. Appreciative of all of the city support over the last several months as we've continued to work through this COVID situation together. And then also very appreciative of my colleagues, Dr. Ockinger and Dr. Jackson, for their perspectives and comments. I certainly agree with all the excellent points and information that they've shared with the group. From our perspective at Lakeland Regional, I think we all agree that we're in a very critical moment on this COVID journey. It's great that we're starting to see some light at the end of the tunnel as it relates to the availability of vaccine. And I'll talk in a few moments about how that has played out for us so far and what we're hoping to do as we move to the future. But I do share concerns that we're in a very potentially dangerous situation if we don't take some action and really work to increase awareness around the potential risks that we find ourselves in right now. We knew going into the winter that this was going to be a difficult time for us as we tried to manage overall patient needs in the community with increasing COVID cases. And I think what really at this point in time, has us the most concerned is over the past couple of weeks, as we've continued to see this very drastic increase in the number of cases out in the community, we've then in turn started to see significant increases in the COVID census at the medical center, again, increasing from, under 100 cases to over 200 cases in just a matter of a few short weeks. And then at the same time, to be seeing these very high number of new cases being reported, looking back in the summer months, we were averaging around 300, 350 new cases a day. And then over the last week, we've been well over 500 in the county. And there's a delay from the time typically that there is that positive test to when that patient may require hospitalization of a week or two. So we're fully anticipating that these new cases that have been reported recently, may then end up further increasing our COVID census, which is, of concern for us, especially knowing that we have already started to open up some of our surge and overflow areas at this time. The other note that I would make is that, the average COVID patient stays in-house twice as long as a typical patient coming in with other conditions. So, when we are admitting these COVID patients, we know that they're going to be with us, for a duration of time that is significantly longer than other patients within our care. To answer Commissioner Reed's question, we do currently have 41 patients on a ventilator that are in our intensive care units, and our current ICU census is running right around 75 in total. Again, those are not all COVID patients. What we've seen is that the COVID patients coming to us for hospitalization this time around may not be as likely to require the intensive care level of care. However, they are very sick, again, stay with us for a very long period of time. But I want to give a shout out to our care team, because I do think we've been learning along the way and have the ability to provide different sort of care protocols than we did back in the summer. So as a result, it has allowed us to be able to look at different ways that we can care for these patients. One of the other bright spots I would like to share as well is we're actually leading the state in the administration of some of our outpatient monoclonal antibody treatments. This is an infusion treatment that can be given shortly after the diagnosis of COVID-19 for patients that are deemed to be high risk. We've given this to over 450 patients so far, and out of that number, a very small number of those patients have needed to be hospitalized after receiving that treatment. And again, these are patients that we would have felt back in the summer months might have required hospitalization. So this is a great story. It's a little scary to think if we weren't able to provide this treatment, what our inpatient numbers would look like right now, but we are very encouraged and feel that though this has been a game changer for those high-risk patients, but yet at the same time, we do continue to see a very high number of admitted patients across the health system. So again, I feel as though we're able to, manage our volumes right now, but I do feel as though we are, kind of on the crux of getting ourselves into a more dangerous situation if these numbers continue to increase. We know that we're stretching, our staff. I think when you look, to use Commissioner Madden's example, when you kind of look at where we are, I do feel like we're in the, cone of certainty, if you will, for seeing increasing number of cases in our facilities. I think when you do look at what is playing out in other parts of the country where, emergency departments are not able to take ambulances timely, having to divert them to other places around the state, running low on oxygen. I mean, there's just a lot of things out there that I think should be, frightening to think could potentially happen if we're not able to make a difference in how we're seeing these numbers trend at this point in time. I would absolutely agree. How do we, try to, get the word out and kick up the awareness and adherence to what we know we need to do? Obviously, we know masks work and we need to, continue to use those in the appropriate settings. I would also agree with the sentiment that I do think a lot of the businesses in the area are doing a great job. So how do we continue to encourage those best practices across the community at this time? I do think we've seen a lot of examples as well of the intermingling of groups, either in large settings or, in more intimate settings at homes or, in dining sort of situations. In fact, we've taken some steps at the hospital where if you went into our cafeteria right now, you would see that we've taken our tables, spread them apart, and really only have one chair at each table. Because again, eating with someone that's not in your household, you take your mask off, you're together for a period of time. Those are the sorts of examples, where we could potentially see spread, and we want to make sure we're doing everything we can to protect our team, and then also try to be good examples when we're out in the community. So again, I think encouraging the use of virtual meetings, not gathering in person unless absolutely necessary. I think some of the practices that were adopted back in the summer when we were experiencing our peak would be helpful from our perspective as well. And then I think just as community leaders, the more that we can all model the good behavior will also be very important. We kind of say you almost have to approach everyone that's not in your household as they could potentially have it, and what would be those steps you would take if that person that you were encountering had COVID to make sure that you're protecting yourself as best you can. To talk a little bit then about the vaccine, we have received just over 5,000 doses. It arrived at our facility on December 28th. We were really charged with administering it to healthcare personnel, both at Lakeland Regional as well as other healthcare providers in the community that have direct patient contact. I'm pleased to report that that process has been running very smoothly. We've been administering hundreds of vaccines per day. And similar to Dr. Jackson's example, we will be finished, or plan to be finished administering those doses this week. We have requested from the state additional allotments. We have been working on plans to do very large scale vaccine administration, similar to what Dr. Jackson was reporting for the county. And certainly, we'll work closely with the county to make sure that residents know what is available and through what venue and organization so that that can be as coordinated as possible. We appreciate the city's willingness to work with us as well on particular venues. I think that that would serve us well to have those large spaces available so that we can make sure we're administering the vaccine in a safe location and manner. We are on the phone several times a week with the state, so I have laid out what we think we're able to do in the way of vaccine administration, so that they hopefully feel confidence in sending more vaccine here that we would be able to provide to the community. But similar to as was shared before, we don't know yet when to expect additional vaccine. And then again, knowing when we got our first allotment, we would anticipate receiving the second dose for those individuals that we have vaccinated to this point to be arriving here in 2 weeks. So we're continuing to monitor that situation very closely. But again, very appreciative of the dialogue today and the city's support so that we can continue to really, focus for the next several months on how critical the situation is and what can we do as leaders in the community to be able to keep each other safe and to make sure that the healthcare system remains, robust and able to care for patients, not just with COVID, but for those that are coming to us with a variety of other healthcare needs, which are also very important to be able to handle and address.
Commissioner Walker.
Thank you, Mr. Mayor. Thank you again, Ms. Drummond, for your particular comments and all. It's always interesting to hear, the various comments from healthcare providers as they do and how many similarities there are here. A couple of things you mentioned. Lakeland Regional Health ranked across the health system for a particular process that you all have administered. Could you speak to that again for me? And then secondly, believing we embark upon some type of a more of a asserted awareness kind of a campaign, you did say something in respect to the fact you believe businesses or those that may be out eating in some of our more public places should take a look at maybe having the separation, if I heard you correct, of those you don't know, that's not part of your household, to be seated at a particular table. I want to hear that again. I want to make sure I heard that to be explained. Because I know you said you all instituted something there at the hospital already, and of course, in what I call them, before we got into COVID-19 situation was, I still say it's a very nice place to eat. It's good food. To be in the hospital, but anyway. So if you can speak to that, I appreciate that as well.
Sure. I'd be glad to. So the first question was regarding our outpatient treatment. So there is a new treatment that's available that is a monoclonal antibody treatment, which is an infusion that essentially evokes a response to that patient's body to be able to fight off the COVID-19 and sustain a more significant response to the disease than they may have without that. But it's critical that that be administered within the first few days of someone being diagnosed. So again, we've been out trying to educate the community that those that are high risk at the time of that diagnosis should strongly consider this, because if you wait too long until you really develop more severe symptoms, it may be too late. It really has to be administered on an outpatient basis. So there's two products available right now. There's an Eli Lilly product, and Regeneron is the name of the other one. Regeneron was actually what President Trump had received when he was diagnosed and had been at Walter Reed for a time. So that really has allowed us, when we knew it was available, we knew that we were treating a lot of high-risk patients here in Polk County. We went to the state and asked for large quantities of this particular treatment. I think they were a little surprised at first how much we thought we could administer here. But again, give credit to our clinical leaders and our physician leaders for really coming up with a great protocol so that we can not only identify those patients, and they could be patients that come in through Lakeland Regional. We've also been working closely with the Watson Clinic to identify patients that are good candidates for this. But it's been 450 roughly to date. We are administering this 7 days a week, really able to turn patients through, readily over the course of the day. And we've seen very positive impact of this. I think last I saw, maybe out of the 450, only 12 of those patients have required hospitalization. And again, these would all be patients that we would anticipate at the time of diagnosis would be high risk for hospitalization. So it's a great story. I know we've had inquiries from other health systems and hospitals around the state because we are doing a much higher volume of administration of this particular treatment than other institutions, and it obviously has served us well, and something that we're continuing to request additional allotment so that we can continue this practice here locally and hopefully allow patients to be able to recover at home, when at the time of diagnosis, and not require hospitalization along the way. And then my second point on the, kind of dining, if you will, maybe more just for consideration, I think out in the community and other, perhaps business best practices that might want to be considered for adoption. Again, we know that when there's individuals that are outside of the same household that are dining together and masks come off, that is an opportunity that there could be spread. So one of the things that we wanted to do was to make sure that we were providing, options and encouragement for our team to not necessarily be dining together or congregating at tables or in break rooms. So we really tried to work to make some facility enhancements to encourage the best behaviors that we've identified to avoid the spread amongst our team that could be out there. So again, I know when you look, say, at a restaurant in town, that it could be that there are folks from similar households, but I do just caution that, because I think as we've gotten inquiries from various individuals in the community about, was there a potential exposure or not, I know I have at least heard that, those situations of dining together, could potentially be a risk point that we should just take into consideration.
Thank you. And Mr. Mayor, if I could please, one last question. As far as the homeless population, as well as, and Ms. Drummond, I don't know if it be you or Dr. Ockinger or even Dr. Jackson, a homeless population, and then of course a population of color, as far as disproportionate kind of situations, still having to face this particular kind of challenge with COVID-19. How can you give us any kind of indication as to, have we done better? Do we see it being taken care of a little better among those groups? Do you have any statistics or any numbers that you can share?
From my perspective, I don't know if I have any specific statistics. I know, based on some of the discussions that we've had in previous meetings, we've tried to make more of a concerted effort in outreach to make sure if there's needs or support around, testing or access to testing, access to these, care pathways that are now available, that we do that to the largest extent possible. Certainly as we begin working on vaccine administration too, so long as we're adhering to the guidelines set forth, by the governor, that we can also, plan to make sure that we're providing the vaccine through our means as well. So I know we've had, discussion, dialogue, outreach, between some of the homeless facilities and shelters in particular, but also making sure that we're taking a broad, approach as to how we're, making sure that access is there for all of those in our community. But I would certainly welcome if Dr. Jackson has a different perspective or more information to share on that question.
Dr. Jackson, do you?
Yes, ma'am. Yes, sir. We have been in touch, or Brenda Redout has contacted us, and we have plans to be able to vaccinate the 65 plus at Talbot House. So that they're definitely on our radar. But again, we will need to stick with the 65 plus age group, and we are, will be, as we have vaccine, we'll be assisting them.
And we did also work with them and others in the area that have healthcare personnel on site too for their clinics and such, because again, to the extent that those that work in the clinic have direct patient contact, they were eligible during this as well. So we were inclusive in our offering to healthcare personnel in the community. It was not just, Lakeland Regional, but it was, really reaching out on our part to all healthcare providers in the community to make sure that they were able to receive the vaccine if they would like to do so.
Thank you.
Commissioner Selvidge and then Commissioner Reed.
Danielle, have we reached the point where the city of Lakeland should look at possible venues to augment your services, whether for testing sites, additional bed capacity, or are we far beyond that right now? Or is that needed? Does the city need to do some emergency planning for what could happen?
Thank you. I appreciate the question. I think from a testing perspective, we're in pretty good shape at this point. Again, we've seen high volumes, but I think with our current drive-through facilities, ambulatory environment, emergency department, I think for right now, we're in pretty good shape. Should that change, though, I'll let you know. Obviously, we greatly appreciated the city's ability to work with us and offer the RP Funding Center early on during this journey to be able to increase that component of it. I do think on the vaccine administration, that may be an area where looking at additional, city facilities could be helpful, just to ensure that, as we do, anticipate getting more vaccine, hopefully in the weeks and months ahead, that we have the physical capacity to be able to deploy that. Going back to the question you have on kind of the acute care bed planning, I think we have good plans to really maximize what we need to do within the walls for the inpatient care. I think oftentimes for the critical illness that you may find with COVID, it can be difficult to try to come up with a facility, outside of the four walls of the hospital. But I do know other, communities are talking about doing those sorts of things. But I think it, may be for more of the outpatient treatments, like what I was, describing before. There may be things for the lower acuity patients that if there was space that, could become available over time, I think it would be wise to at least understand what those would be and what sorts of, services that we could be able to house there to make sure that we've explored every angle as we work to ensure that we can best care for this community.
Thank you, Danielle.
Commissioner Reed.
Thank you. 2 questions. How many tests are we giving per day? And then Dr. Jackson, you were going to give us a phone number. I was going to write it down. I need to get in line as well. So if you would mind giving us that phone number. I have part of it written down, but I'm still waiting for the main number. But thank you.
Okay. So, thank you. The COVID vaccine hotline is 863-298-7500. Again, 863-298-7500. And I will echo Danielle's comments. In the last 7 days, there have been over 24,000 COVID tests performed in Polk County. This is from a wide range of public and private partners. So I really feel pretty comfortable at this point that anyone who wants or needs a test can find it. The county website is still being updated for sort of public vaccine access. Obviously, healthcare providers offices. Many of them are also providing testing or access for swabbing and testing. But I feel pretty comfortable with that volume of testing on a weekly basis, that there is adequate testing in the community.
Thank you very much. Other questions by commissioners? Commissioner Mann.
Thank you, Mayor, and thank you, Danielle, for your update. I do want to just ask, this summer you had extra beds, and you know, with the reports that we received give percentage of beds, you know, and the opportunity, you know, for more beds throughout the county. Although even when in July the numbers were on the increase, you had bed capacity, but to Dr. Ockinger's point earlier, the healthcare workers became more of you know, the capacity issue. So even though you have beds, you may not have the staff, you know, to work those extra wings that you have in case of the surge. Could you speak to the actual healthcare worker count? And certainly it sounds, you know, hopeful, you know, if they're the first being inoculated, that they will, you know, not have to then have so many quarantine procedures where if one team member is out, the whole team's out, you know, that which will help, I would imagine, with your worker capacity, having the vaccine. But I was curious just to how you're doing on your actual healthcare worker count with regard to if they're, you know, if the numbers continue to surge.
Yep, thank you. Great question. I feel as though overall we're in a pretty good position. Recognizing where we were in this spring and summer months, we really worked throughout the fall to try and hire up and above where we typically would be. So just as a point of reference, we have typically been around 5,500 team members across our organization, and that number has now increased to 6,000. So we, I think, did a great job with our nursing leadership, our human resources team to really go out and try to make sure that we were in as good of a position as we could be, because as Dr. Ockinger pointed out, in the summer there wasn't this sort of global incidence at the rate that it is now. So there were providers in other parts of the country that were willing and able to come down and help us with temporary staffing, agency staffing. That would be very difficult to find right now. So we really are having to rely on our existing team. I do think, again, that the incidence hopefully will remain low among them getting COVID, and the vaccine should only help. We're very appreciative that we were able to vaccinate any team member that has patient contact that wanted to receive that vaccine. So I think as it relates to that, we're in relatively good shape. Again, it's just at some point there, is that upper limit on what you can handle. We had said this summer, that we had really set kind of the 1,000 patient mark as, where we wanted to be able to accommodate. We felt as though we could physically handle that and would be able to have the staff to handle that. And last week we really had gotten kind of up to that 900 mark. So just as a frame of reference as to, where we've been trending, it's certainly higher overall than we had been this summer. Have staff obviously feel in a really good position as it relates to, all of the PPE and supplies and things that had been a challenge early on, to feel that we're well equipped with our equipment and capabilities. But I do think, at some point there is that upper limit that you're able to accommodate as it relates to both, your space and your staff. And, certainly want to make sure that we're doing everything that we can to continue to care for anyone that comes through our doors, be it for COVID or for other types of health conditions.
I have a question to ask the healthcare leaders, which is, when it comes to public gatherings, what is the size of public gatherings that you think beyond this number it becomes pretty unsafe? And the reason I'm asking the question is primarily for the kind of compassion-based organizations that want to follow some compliance in terms of what's reasonable for this limited period of time until the numbers go down to expect or request. And some of those would be organizations that meet weekly, that are starting to now come together because of the fatigue of being apart. Where would you caution they not get any larger than for perhaps the next 60 days?
I don't know if Dr. Jackson would want to comment on that based on what she's seen in the way of incidents locally. I know there's been a few numbers that have been, thrown out by various organizations or entities.
I don't know, Mayor, that there is a definite number. It's just avoidance of large groups. Again, there's no state mandate that they can't occur, but it's just avoidance of large groups as much as possible. I don't, again, have a number associated with that.
So if we were trying to guide them, and I'm anticipating this could become a part of our discussion, so that's why I'm asking this in advance. If we're trying to guide them, what we'd really ask them to do, that if they are going to meet in a larger group, that they have social distancing protocols reenacted, because most of these have abandoned those at large. And I think it's the back to the fact that we've gotten past an election, we've gotten past Christmas vacation, we are all sick of COVID, a vaccine is in place, and so now it's time to reassemble because it's also 2021. Those don't matter to the virus, none of those facts. And so we have to re-up our game and make recommendations re-up the game. So that would mean we'd stagger places where people sit, as you've done with a hospital cafeteria, for example, and the amount of places that people would sit, and we'd encourage people to sit as families if they're meeting together as families, but that we would not deem it wise at any level to have large gatherings where we're not practicing any of those protocols. And in fact, what we're doing is advocating the spread of the virus instead of trying to be compassionately centered in terms of what we do to mitigate it, correct?
Yes, sir.
Mm-hmm. Yeah, I would agree. I mean, I think there's sort of setting that number. And then there's also, as you point out, the practices that need to be there sort of regardless of the number, right? So it's, if you're going to, have a group of any size together, making sure that they are not only distanced, but also, having their mask on the entire time. So again, that's where I think things like, eating and drinking, over the course of those events can become problematic if those things occur. But I would agree that I think, kind of setting the size of the group, could be an important factor to consider as well.
Commissioner Matt.
Thank you, Mayor, for bringing up the gatherings. I think that's really important. I haven't really, contemplated that. I've not been back to a large church gathering, and, so I forget that other people, are doing that and may, with the new year, feel like it's 2021, there's no virus, and we don't have to, do the CDC guidelines. So I think that's an excellent point as far as, for this body and what we are able to do with regard to a policy versus just to advocate and to lead and just make suggestions. I do want some clarity from the science, since we have our scientists here, with regard to gatherings. Certainly it sounds like no matter what the number is, it's the close proximity, it's eating together, it's breathing, on each other, that is, kind of the imperative, more than even if you're 10 and you're clustered together and very intimate, that could be more of the super spreader event than the 1,000 where you're all spread apart, wearing masks and following the guidelines. So if you could, just not to be redundant, but to talk again from each of you from a science perspective to gatherings, and then also to outdoor gatherings, because, we have our Saturday market that we've spaced out our tents and things like that. But, going into the spring, I just am curious, what are the findings now that we're more familiar with the virus? Is it still, is it conclusive whether or not it is, more virulent in a indoor environment versus an outdoor environment?
I can speak to that based on what's on the CDC website, and the general rule of thumb, and I will then come back to why it's hard to make these hard and fast rules. The general rule of thumb to reduce transmission: outside is better than inside. Small groups are better than large groups. Further apart is better than close together. The complexity of it is that we can't make the virus mold to us. And if you even have somebody outside that is super contagious, because they're in that window where they're shedding a lot of virus, which may be before they're symptomatic, the virus doesn't follow the rules that we've set. These are guidelines. So does that mean that every outdoor event is safe? The answer is no. They're safer than if that same event was held indoors. But it depends on if somebody coughed or sneezed before you walk through their aerosol and their droplets. So they're not hard and fast rules. There's just general guidelines, and everyone needs to sort of assess their threshold for risk and whether they're willing to accept the risk to attend something.
Dr. Ottinger.
Yeah, I would, not to just completely reiterate Dr. Jackson's point, but it is, the issue of whether or not this disease spreads through respiratory droplets versus airborne transmission, has been subject of quite a bit of debate. It's clear that it's spread through respiratory droplets, which means that these droplets do fall to the ground, and it's kind of in a cone-like fashion around each symptomatic or any person who's a viral shedder. So if you stay 6 feet away from them, it's not a guarantee by any means, but it's very unlikely that you're going to contract the illness. The problem is that when you start gathering large numbers of people together, and then inside especially, you have to take into consideration the ventilation, for instance, the airflow patterns. What are the people doing in this group together? Are they singing, or are they in silence and not speaking? There are so many variables. It's really hard to give it one size fits all. So I think that's where just the guidance gets difficult to give to someone if you're not going to follow the fundamentals, which is to be masked if you're indoors and to stay 6 feet away. Once you start breaking those rules, and it gets very, very difficult to give you any clear guidance on what's safe and what's not safe. So outdoor, you're seeing the studies are conclusive that outdoor events are safer than indoor events, probably mainly due to the fact that of the fresh ventilation. It's not stagnant air that's being kind of recirculated. But also perhaps it's easier to stay further away from somebody when you're outdoors rather than indoors. So a lot is clearly, not tagged down in terms of what is quote unquote safe, but we can say what's more risky for transmission.
All right, well, I appreciate those comments. I think at this point, let's transition a little bit, and healthcare leaders, based on your schedules, if you can stay on, great, and if you can't, we understand that, and we could come back to you later. But we want to come alongside you. That's the goal of this entire conversation. That's the goal of the commission. We want to do it in a short-term period of time where we can watch success take place in the numbers so that it reduces your concerns for both staff as well as the spread of infection within the community and lowers the rate of deaths. We recognize we can't do it with punitive mandates unless the county would perhaps consider doing that and requiring it from commercial businesses. So probably we're posturing ourselves to make a very strong city-based statement on what we would like to see businesses and organizations follow for a specific period of time in hopes of helping to drive the numbers down, recognizing that we're strengthening those organizations to say, look, yes, no, it's not that it's against the law and you're going to get put in jail or pay a fine. This is a raised awareness that we are being asked to comply with because we're trying to be compassionate about the needs of others. If that scope is about right, then I'd really appreciate the commissioners kind of weighing in and addressing their thoughts on that. So Commissioner Selvage.
Thank you, Mayor. I agree with what you have said, but I will remind my colleagues that this is not a City of Lakeland problem. We call it the Lakeland Regional Health System. And so we are dealing with people who do not live in the city, yet use these facilities and impact them. So what I'm going to recommend is that we strongly encourage our colleagues at the county level to join us in what we decide to do. None of us know really what the truth is. Instead, I'm not an epidemiologist, I'm not a doctor. You have to choose who you believe. Do you believe radio talk show hosts, politicians, or do you choose to believe experts? And I just want to tell you some of the words, repeat to you some of the words I've heard this morning from 3 experts locally. Words do matter. So I've heard from these 3 distinguished professionals words: imminent staff shortages, overwhelming, very critical moment, potentially dangerous, unable to provide services, buckling, frightening. So I think we've reached the point where cheerleading is not enough. This is a crisis if you choose to believe the experts who are talking to this morning. So with due respect to my colleagues and to the mayor, I am proposing that we immediately impose a mask mandate for the next 100 days. And as a second part of that, that we strongly encourage the county commission to do likewise. Thank you, Mayor.
Thank you, Commissioner Selvich and Commissioner Walker.
I think Commissioner McLeod's hand was first, so I'm about to you, Commissioner McLeod, and I will follow behind you.
Well, thank you, Commissioner Walker. I know we'll all get our turn. And thank you, everyone. Thank you to the Danielle, Dr. Ockinger, and Dr. Jackson for taking the time to share your perspective, what's going on, your recommendations, and the work you've been doing for many months now. I think Commissioner McCarley said it well. You didn't sign up for this, these conditions, and it's been a Herculean task. And yeah, Commissioner Selvich, I agree on the point that this is a problem that's bigger than the city of Lakeland. I think we all know that. One of the things, the question of the mandate, and I know, Mayor, to your point, that we can't vote on this virtual forum. So if we take action of some sort, we've got to reconvene in person. But when I look at other counties and places that have, where mandates have remained, they're surging as well. Hillsborough, Orange, and their numbers may be slightly lower than ours, but to me, it's not significant to point to a success of a mandate. And I don't know if that's because there's still non-compliance, or as we've talked about this morning, you have people gathering in homes and privately where a mandate doesn't reach that, or if there's been an enormous amount of travel over the holidays. And I think maybe it's a collection of all of that. And so for that reason, I won't support the mandate. I think this is a time for a renewed awareness push. I think what I saw from Lakeland Regional over the weekend was great, just to say, hey, we're recommending urging, if you're outside your home, to avoid unmasked gatherings unless people have tested negative. And that kind of message, even for us and our family, was just sort of we realized, hey, this is still very serious and real, and we may need to rein it in. And Danielle and I talked yesterday, and I think behavior over this pandemic, it ebbs and flows, and we have periods where it's just the mitigation strategies go against what is natural human interaction. And so there are times where we let our guard down and we shouldn't. And so this is a time to come back and say, we really need to rein it in and follow the mitigation strategies. But if we can amplify that message as city leaders, I might support some sort of resolution for that. But at this point, no, I wouldn't support the mandate.
Thank you for that comment, and I think it has a balanced approach. Commissioner Walker.
Thank you, Mr. Mayor. And I, too, at this point, would say, as I've heard from the 3 professionals who are in the health care system, who I know we all lean to their advice, but it was predicted, prior to even this point today, coming into our winter months, as we call it here, by even some of the national healthcare professionals, that we will be seeing an uptick as it has been. And I hear what has been said by the 3 of them on the call with us today. Social gathering, has been a challenge, I think, for many situations, as well as not adhering to that particular situation when it comes to social gathering and social distancing. And at this point, I cannot, you know, and I hear my colleague when he made the kind of recommendation, but I don't want to be able to tell another body, even, you know, what they should do for their particular policy-making situation. I have sat here for a number of years, as many of you all know, and as well. And sometimes I hear a lot of times how we should go do things with saying what the educational component of our city should be like. And I talk to them. I think we all do. And I think we should suggest, because they're elected officials like we are. But to say that they must mandate something, I can't do that, because I don't want them telling me what we should mandate in Lakeland. It's not under their purview. It's why we have this, I think, the different levels of government. But I think I am poised to do what I think I've heard through Ms. Drummond and, of course, Dr. Jackson, as well as Dr. Ockinger, and do what we can to bring about more emphasis and more of a profound way of sharing by resolution, as I think it was mentioned already by Commissioner McLeod, about what we're facing now, how we can move forward with, you know, helping support what they need and what our citizens hopefully can do and will do to provide a better outcome for us all. A sidebar, and I hope you all can appreciate my comment.
I appreciate your comments, Commissioner Walker, and I want to echo that I suspect if we craft this wisely and make it something that's relatively palatable, that we'll find that there are other Polk County cities that will come behind it, and the county might even endorse it. So, Commissioner Selvich, if we make the recommendation on this strong enough, but recognize we're not asking for their necessarily endorsement, but if it's one that, let me just kind of craft something in my head and then you can pick it apart. We say through March 31st, you know, so from now and through March 31st, we are trying to raise an enhanced awareness of the severity of the crisis and ask for increased intentionality and compassion to consider how we can protect in ways that where our guard has lowered. That will include masks, that we ask every large gathering to ask and request be included, social distancing appropriately by family units or by tables in restaurants, for hands to be washed, for I guess crowds, I already said that, to be minimized. I'm trying to hit the very same things, and to be guarded in the amount of personal time that in our personal spaces, to be a little more guarded about who are included in those when we're more relaxed, just during that 90-day period or however many days it is through the end of March, to watch and see what we can accomplish with the reduction of positivity. And if we're back into the zone under 10%, 5% at that period of time, we let that recommendation lapse. But in this period of time, we would highly request an increased attention and vigilance to that end, something in that regard.
Well, well, I hear you, Mr. Mayor. I was not finished, but you came in and said what you had to say. But certainly, I appreciate your comments. But I want to also say I can agree with what you just said, even at this point. And I think the resolution that I think was even mentioned by Commissioner McLeod to bring forward that kind of awareness, I can go along with something like that, surely. I think it has to be crafted properly, as you indicated. But I'm surely not at the point of wanting to mandate another body of elected officials to do anything, but I can suggest as well what I think is best for us overall.
Commissioner McCarley.
Thank you, Mr. Mayor, and thank you again to all of our healthcare leaders. We truly do appreciate each and every one of you and your teams. Your care teams are amazing. So thank you please share our applause to them and kudos and gratitude when you go back into your offices, because without you all, this would just be a calamity beyond all measure. So after hearing what everyone has said today, I agree, Mayor, I like the idea of a resolution that Commissioner McLeod suggested rather than a mandate. But I think there are a couple other things that maybe we can encourage people to do, including if we have community groups who can meet virtually, that would be good. I know that we've all been a little more eager to get back together, for instance, at ribbon cuttings and different things like that. I think that might be something we heighten awareness of, putting the pause button on bringing people together, inviting people to come together. This is entirely a local issue, and I appreciate listening to our local healthcare leaders talk about what's happening in Lakeland. I want to echo what Commissioner Madden said, that for me, throughout this entire pandemic, I've tried to look at what's going on locally, not get sucked into the vacuum of what's happening in New York or what's happening in larger cities around the state, but really being super focused and vigilant about what we're doing locally. All the factors that each professional shared have to happen. So we have to be willing to wear masks. We have to be willing to work in smaller groups or virtually as much as possible. And we have to wash our hands. So I think that although everyone has extreme fatigue in doing these things, we must go back to encouraging all that behavior and being leaders in doing that and wearing our mask. If a mandate were to help local businesses, I might think about it, but for instance, when we go into our supermarkets, which Publix is my supermarket of choice, there are people who don't wear masks, and it is up to the business, I think, to have the accountability in the stores of, saying, but where we go back in the beginning of the summer is, was that the business's responsibility? Well, it's in that we made it harder by not having a mask mandate. That's where I'm in sort of a cloudy area of business property. Private businesses can ask for people to wear shoes and ask for people to wear socks and shirts and not come in bathing suits or whatever. So I think they can continue to encourage people to wear masks in those large gathering places. And we do not want to get to a point in time where we hinder our business community and shut them down if the state shuts them down again. And if these numbers continue to increase, I doubt that Florida will do that, but we will see that across the nation. And I think that it's something that we don't want to see happen here. So I would just kind of piggyback on what everyone else has said. I do think I would hesitate on a mandate per se, but I would like to encourage all the leadership throughout Lakeland to go back to online meetings, wear a mask when they can, have smaller groups, and really be focused and family-centric, and your bubble, and staying home and washing your hands. We have a lot of children in school. I'd like to see schools continue to stay open and that be an option for students to attend school. I think that is one of the slippery slopes of this, as far as the asymptomatic people that we might have come into contact with. Encourage your kids when they come home to wash their hands, immediately walk in, have one place for backpacks, Lysol them down, do all the mitigating factors you can at home, because the asymptomatic piece is what I think people have most fatigue over. We don't know what we don't know. And if you don't look sick and you don't act sick and you don't have a temperature, it's really hard to know whether you even have the virus, is what I'm hearing from the healthcare professionals, much less if you're sharing it. So I think it was Ms. Drummond who suggested or maybe Dr. Ekinger, we assume that everybody we come into contact with that's not in our immediate family may be a carrier. And I know it's tiring, and I know we're a year into this, and I apologize for that, but it's something that we continue to have to do. And I think some of the frustration comes from the not knowing what's going to happen and when we're going to have the vaccine complete and when we're going to have herd immunity, and when this is going to go by the wayside. So I would just, completely affirm a resolution and saying we're taking it seriously at City Hall. Our departments are taking it seriously. They're meeting online as much as possible. The healthcare entities are doing the same thing. Other businesses are doing the same thing. We put a pause on community meetings and try to mitigate in that regard to help underpin and support the healthcare system. The one last thing I will say is that going to Commissioner Madden's analogy of the hurricane cone and Mrs. Drummond's comment on that as well, is we are in the cone it's here. These numbers are peaking and spiking, and there are a lot of other there's a lot of other context around more than masks. That we have let our guard down. I'm included in that. You know, we're to a point where we're just kind of over it. I wanted to see family at Christmas. Thankfully, no one's gotten ill yet, but we're watching and being very careful as we move into the new year and trying to go back to some mitigation efforts that will keep us, you know, COVID free, I hope. So thank you again to the professionals. We wish you very, very well in your endeavors and how we can help do this. We're here to stand beside you. Thanks, Mayor.
Thank you, Commissioner McCarley. Commissioner Selvage, were you trying to say something? I'm just double checking. All right, Commissioner Madden.
Thank you, Mayor. I've actually received a couple of texts even, you know, during this meeting, particularly with regard to nonprofits, to weddings, those events that are annual, that are planned, you know, months in advance, you know, kind of made me think about also Sun and Fun. You know, certainly coming into this meeting today, you know, my focus was we've gotten past the holidays. We knew this surge was probable, you know, based on family gatherings and some more intimate eating together scenarios. But what I don't want to do is leave this meeting and, you know, in July, we talked about a mask mandate, you know, coming off of a shutdown to then try to stay open and have some protocols in place so that our businesses could function and have some viability, you know, going forward. To me, I think what we've really been able to do is some of those businesses have really implemented a lot of protocols. You know, kudos to those businesses who have been cleaning and sanitizing and retrofitting their businesses. I think that what we haven't addressed maybe as much, which is what I wanted to with the outdoor versus indoor gatherings, as you know, you have brides who have been on, you know, the third time planning their wedding. You have nonprofits who may not be here, you know, a year from now if they don't have their annual fundraiser, the one they canceled last year, and they're on pins and needles waiting, could they have it, you know, in February or in March, or is May the safe date? And I don't know that we can provide them that certainty, you know, with regard to the vaccine distribution and how much capacity there'll be and how many people can be immunized in a timely fashion. So that, to me, as a policymaker for the city of Lakeland, you know, we do have venues that we, you know, allow folks to rent, you know, for their gatherings. What is realistic as far as, you know, the city of Lakeland leaders, number one, you know, if it's a 100-day mask mandate, you know, does that suffice that we're safe when we have weddings and nonprofit events and chamber events gathering in buildings? Is that, you know, sufficient mitigation? Does that make the nonprofits feel like they can have the comfort level to have their event this year because they feel like people will actually, you know, wear the mask because, you know, that's mandated? Is it more than a mask? Is mandating masks really not sufficient because maybe everyone's used to wearing masks, but they're not washing their hands, they're not sitting 6 feet apart, they're not doing some of the social distancing? So I really feel like, number one, we need to really think about, you know, what is this 100, you know, everyone, I do believe, and from the texts I've received, has reinforced that they feel it's 2021. You know, I had my June event, it's supposed to be now in February, or, you know, my October event is now in March. Is it, are we to think that those are viable options to have those events? Are we encouraging people? Yes, if they do wear a mask and they do this, that those are fine. Secondly, another text that came through to me was, you know, so maybe, you know, we're talking about Hillsborough's mask mandate and their numbers. I hear people all the time say California is as closed down as anybody, and they still have big spikes. So none of this works, you know. I'm not saying I agree with that. I'm just saying that sometimes is the sentiment. You know, you be as harsh as possible and, you know, shut down, you still have a spike. And I know that might be maybe some feelings of our Polk County. You know, maybe it's because we're a rural county, we're spread out anyway, you know, that they're not comfortable, you know, to make a mandate. I would urge what are they comfortable with? I would not want to pit myself against the county saying, well, we do mandates and you don't, and we believe in science and you don't, or whatever it is that would cause more division at this moment. You know, whatever, you know, wins friends and influences people, you know, whatever causes us to hold hands and collaborate is what I'm interested in. So if that's, to Commissioner McLeod's point, a resolution, and that makes the county say, hey, you know, I'm not comfortable with the mandate, but I'll go, you know, I'll work in tandem with the resolution so that when we drive across the street from city to county, you know, we know that both restaurants or both gatherings are going to have the same rules. You know, those are my two concerns before we leave is what do nonprofits and weddings and large gatherings, what can they expect in the city of Lakeland, you know, going into this spring? And that includes, what are we going to do? I mean, I've heard last year, if Sun and Fun doesn't happen, then there'll be no more Sun and Fun. You know, that's kind of similar to some of the nonprofit boards that, you know, I sit on. And then secondly, how can we, you know, work together with the county instead of working against each other on who's going to be more better on mitigating, or who's going to be more, you know, loose on mitigating this? How can we say, what are you comfortable with? How can we work together to make sure we're on the last stretch of the race here? We want to make it to the finish line and get people vaccinated. We don't want anybody to die before we get that to happen. You know, how can we work together?
Well, I think that is an excellent point, and that drafting, that pulling together and creating a resolution is probably the way to do it. Having had some conversations with the county, I don't think we have a mandate. We should have a mandate expectation at any level, but I do think they might come alongside a resolution recommendation. If we took the time to kind of craft that together this week, and perhaps even as commissioners, you bulleted some of the things you wanted to be sure were included, we could have a draft to consider at our Friday agenda study to be able to think about and talk about. And certainly I can coordinate with both Emily and Palmer to that regard in terms of creating that as a proposal, giving you a draft back maybe by Thursday night that you can have some time to think about and work on before we'd ever meet on Friday. And then we could make that as part of our recommendation as early as our Monday commission meeting, if you wanted to pursue something that way. So I'm just tossing that out to be open. I also have some other texts that are, I don't want to take us off track of that are specifically related to the healthcare community experts that people want to ask. So first of all, before you leave, please allow us to have an opportunity to do that. But as commissioners, what would you think about a plan to create a resolution by Friday? Everybody in? Okay. All right. So not to extend this discussion and take your time unnecessarily, we will do that. And Commissioner Selvage too, we will work. We're very interested in the strength of this. I'm very appreciative of your desire for a mandate in terms of the securing of it. I do think we're at a moment though where if we can help equip organizations to say, look, they've asked us to take a step back. We're going to comply and we'll take a step back in the process of this, that we have probably potentially the greatest win available to us. Those organizations that won't really respond to this resolution probably would have an adverse reaction if it's crafted well. And maybe that's not all so bad. And it would, Stephanie, Commissioner Madden, to your point, it would encourage people probably to do outside gatherings as they think about what do we do between now and at some date we put as the end date on this in the interim period of time, and maybe help them plan as a result of that. Okay, other commissioner comments, reactions. Commissioner Selvage.
Thank you, Mayor. I certainly defer to the judgment and comments of my colleagues. I want to clarify, in no way am I saying that we should limit businesses or organizations gatherings. I think we need to make sure that go ahead with those things, but follow the guidelines that we're suggesting. I'm not in any way suggesting a lockdown or closing down businesses, but certainly I will support any way I can, whatever we can do to make increase awareness and attack the problem. Thank you.
Excellent. Commissioner McLeod.
Thank you, Mayor. Just really quickly, a follow-up question. I know we had mentioned utilizing city facilities, RP Funding Center, potentially when vaccine supplies are available. Is there anything that we need to be doing as a city to be ready for that strategy to be in place to hit go the minute those supplies are available? And I'm just thinking through that. And Emily, maybe you're already on that. I don't know if you want to weigh in, but I just wanted to mention that so that we're thinking ahead on that front.
Sure. We are currently having conversations with LRH and Watson Clinic, both just talking about facility needs as it relates. Similarly, how we plan for the the testing rollout, we're planning for vaccine rollout to support them in any of our city facilities as we can. So we're just working through logistics and planning. And then as Dr. Jackson, well, I think everyone said, we don't have an abundant amount of vaccines yet. So it's doing the planning for when that day comes where we get more, that we can adequately disperse them and dispense them.
Excellent. So we are fully engaged 100% to go if they need it, and they know that.
We're in the planning to get there.
Right. A couple of questions. We had, and I suspect these questions would be broader for some other community members as well. We've had people who have had COVID. What are their needs with respect to the vaccine? Do they need to get vaccinated, or are they, if they have had COVID, are they able to go on because without a vaccination?
I don't know if Dr. Jackson's on. I could answer that. It is recommended by the CDC that those who have had COVID-19 do go ahead and receive the vaccine. It's not clear how long the immunity due to natural infection lasts. So that's part of the reason for the recommendation. And so I would say affirmative, yes, that those who have.
So that doesn't preempt you from the need. Okay. And then another question was, someone is not 65, maybe they're even 64 and a half, and they have underlying conditions, and they are very concerned about getting COVID, heart-related or some diabetes or other issues. What should they do to prioritize themselves, and is there a method at the present time for the vaccination?
I meant what we're planning to do with respect. Oh, sorry, Steve, go ahead.
Go ahead, Joy.
So from a Lakeland regional perspective, there is a provision in the governor's executive order to be able to administer vaccine to those that we deem extremely vulnerable to COVID-19. So we're taking a proactive approach in, having a screening and intake form so that as part of our, plans with regards to a broader community rollout of the vaccination plan, that in addition to those that are 65 and older, that we can also, offer it so long as we have, the support through this screening process to ensure that individual, would qualify based on those other health conditions. So we are planning for that as part of our rollout plans, hopefully in the coming weeks.
Excellent. Commissioners, did you have any other questions that you wanted to float? All right, then our game plan will be this. We will work on a resolution in preparation for presentation to you at least by Thursday. And for our discussion on Friday, that will be a ramped up call from some period. Is there a recommendation on the time period by any of the commissioners or the healthcare provider? Commissioner Walker.
I believe the March 31st day is a good time period. That's, well over, I think, close to 60 plus days now. So I'm not saying we should not go beyond that date, but I think this is a sufficient date.
Healthcare comments to that end.
I mean, I think it's a reasonable starting point. I would just encourage, I know we've been talking about the positivity rate and tracking that. And I think equally we can continue to, keep commissioners apprised as to what we're seeing in the way of hospital capacity, so that you all are aware of hopefully what will be an improvement as we move forward. But I think the current state of the hospital capacity and capabilities would be another important piece of data just to continue to monitor as we move forward.
Dr. Ockinger?
No, I would say any time period is completely arbitrary. So between 60 and 100, I'm not so sure what criteria you'd use to decide between the two, other than this is an ongoing problem. And until we get, upwards of 70% of the population, somewhere between 70 and 85% of the population vaccinated, we're still going to be dealing with this. So.
All right, and so I think the second meeting in March that we would deal with, whether or not we would extend it at that period of time based on the facts that we see. But what we're really trying to do is create something that is creating community compliance and compassion. That's what we're asking for, and ramping up the intentionality. And so that's kind of the balance between an extended length of time beyond that. Okay, so we'll shoot for March 31st. As Commissioner,
I did want to just add, I feel like that would be smart. I don't know what date our meeting falls on in March, the second meeting, but March is certainly all spring break, and we would want to with the last year, the surge has been around a holiday, so I wouldn't want to be voting on whether or not to continue these mitigation strategies right when people are about to go on spring break. So I'd love that to be predetermined, that we are past those dates.
Are you suggesting even beyond March that you would want that to be April?
I would prefer that we talk about it maybe at our April meeting, not at a March meeting when folks are traveling and going on spring break. It just seems if we're thinking to go through March with whatever we decide, unless we see absolutely the percent positives are negligible, I would say that we want to get through March and then have a meeting about it.
Maybe an April 15th or something like that. And Commissioner McCarley, you have a comment?
Well, I was just going to say our second meeting in March looks like March 15th. So yeah, that's half the month. So that leaves 2 more weeks. So I'm with Commissioner Madden to push it into April. And our first meeting is April 5th. So then our second one would be the 19th. So the April 5th is the day after Easter. So probably the 19th, maybe even.
Okay, so maybe make it through the 19th. Okay. That's good suggestion.
Anyway, we got to get through March 31st. So it would be sometime in April. So
sure. Sure, but I think if we're trying to craft a resolution, they're just trying to come up with a good landing spot that makes it palatable, and spring break protection is part of that conversation. Commissioner Reed.
Thank you. Again, I really prefer the March. We're going to be coming in April and potential fly-in stuff, and I don't want to hinder into that if at all possible. It's just a big economic boost to the city of Lakeland, as well as the potential livelihood of the fly-in itself. So again, we still have the opportunity to expand it in March, as opposed to mandating it or our resolution going beyond that point.
Okay, so certainly that can be a point of our discussion on Friday. Those good things to kick around and think about. Any other points you'd like to make sure that our City Attorney Davis considers that haven't been mentioned already? Okay. On that basis then, I did want to make one other comment if I could. I'm going to check my text to make sure there's no other texts here from other people. Then I want to make one other comment with respect to the last question on broadband at the last meeting that we had. This is unrelated to the specially called COVID discussion meeting that we're in now. And that comment is simply this to the broadband committee. Until we are through all the negotiations, there isn't anything for the broadband committee to have to think about or do. We really want to think about these as 2 separate parcelings. And I think that's been stated, but I just want to make sure to be abundantly clear. We have made the recommendation as a commission for that negotiation. When that negotiation's finished, then that'll flip back. That keeps it from being difficult, from having to be public discussions as those negotiations finalize. Any questions on that at all? All right. Is there a motion for adjournment? Commissioner Walker and a second by Commissioner McCarley. All those in favor, raise your hand. Thank you so much for your time and for Dr. Jackson, Dr. Ockinger, and Danielle Drummond. Thank you so much for carving out this important initiative. Appreciate it. We're adjourned.